studio who's given us some excellent advice on obstructive sleep apnea, OSA. CPAP, continuous positive airway pressure. It's the most effective therapy for treating moderate to severe OSA. May also be used to treat mild OSA if other treatments have not been successful. A CPAP device is a small pump that delivers a continuous supply of compressed air through a mask that either covers your nose or nose and mouth. The compressed air acts like a splint, preventing the throat closing and maintaining upper airway patency. Most patients require lifelong therapy. CPAP is a well-established treatment with a solid evidence base. As well as reducing snoring and tiredness, it can also reduce the risk of complications of OSA, such as high blood pressure. Possible side effects of using a CPAP device can include headache and ear pain, mask discomfort, nasal congestion, rhinitis or nasal irritation, claustrophobia, and also disturbance to their partners. This can sometimes lead to problems with compliance. If CPAP works, as it does in most cases, then there is an immediate improvement in sleep. Studies have shown a positive benefit in terms of reduction in daytime sleepiness, snoring, and improvement in cognitive function and general health status after just 4 to 8 weeks, which is great. I will also be interviewing Dale Smith, who suffers from OSA. He has kindly agreed to talk to us about his experiences of OSA and the CPAP device that he uses. Hello, I'm going to be interviewing Mr. Dale Smith today. Thank you for coming. He suffers from obstructive sleep apnea. He's one of the 25% of the UK population that suffers from some kind of sleeping disorder. So Dale, can you tell me when were you first diagnosed with OSA?
May 2014.
Okay, and how did they diagnose you? Can you tell me a little bit about what happened?
Yeah, I was suffering night times. I kept on waking up during the night, every hour or something like that, in a panic, thinking I want to go to the toilet. You go back to sleep again, might wake up again another half hour, go to the toilet again, wake up 4 or 5 times a night. So I went to the doctors and I had to fill in a questionnaire of how many times, when I would go to sleep, if I was watching telly, would I go to sleep, what have you. The scores was out of 21 points, and out of 21 points I scored 19. That's not good, that's bad.
Right, okay.
7 is good. So I scored 19. And then before the doctor had a chance to send me to a specialist or anything, I woke up 3 o'clock one morning, walked around the bed and collapsed, banged my face against the bedside cabinet. He gave myself 51 stitches to the face and broke my nose at the same time.
That sounds awful.
It was. But then, once the doctor had seen me, he actually turned around and said, we'll see a specialist. So the hospital got hold of me and I had to go up with a machine, take to my chest and put some tubes put up my nose, and I took it home in the night and had to go to sleep. Take it up in the morning, take it back to the hospital, and then they could actually tell me or look at what my sleep pattern was. And they called me back into the hospital after a fortnight. And
and that's when you were diagnosed. It did have quite a profound effect on your life before. So what's happened since? What kind of treatments have they given you or suggested you do to help with the sleep apnea?
I now sleep with a CPAP machine.
Okay, so a CPAP machine, do you know what that stands for?
I don't know what it stands for. I've been told many times what it stands for, but I can never remember. But it's about controlled air pressure.
Sure. Continuous positive air pressure.
That's it.
Okay. So can you just explain to me a little bit about how it works?
Yes, the machine is quite simple. On this side there's a humidifier. So you just take that out up and fill that with water night times.
Okay.
Up to the mark. Place it back into the machine. Shut it up. Then you've got a mask, you've got a choice of mask.
Okay.
You've got a full face mask.
And what's it like wearing the masks?
That one there, I don't like that one.
Okay.
I feel very claustrophobic with that one on.
Okay.
And you can't talk or anything. You know, if you want to say anything, you can't talk because it's over your mouth.
Okay.
So I use a nasal one.
And you have to wear this all night?
Wear it all night. When I go to bed at night, I fill that up with water. I press a button, and it gives me my temperature.
Okay. Alright. Is it quite noisy?
It's noisier now while I haven't got it on.
Oh right, so once you've got it on.
If I put it on,
okay.
If I put it on for you.
So I was just thinking about, obviously, you know, your partner or wife, would it interfere with their sleep?
That's it.
Actually, it's quite, you can't hear it, can you? That's, yeah, it's quite a low sound.
The only time you can hear it is if I want to get up to go to the toilet or get a drink.
Brilliant. Okay, yeah. So have there been any side effects to wearing the, or using the CPAP monitor?
Using the CPAP monitor with the humidifier, you can warm the air up so it's nice warm air on you. If you don't have the humidifier, you do get a dry throat. And the air is very cold, and you wake up the following morning and you think you've got a cold because your nose is running all day. With the humidifier, might get a dry throat a little bit, but it's more bliss. Okay.
So how do you think using the CPAP monitor has changed your life?
I can sit down and talk to you and not go to sleep.
So you're falling asleep all the time?
So it's super.
Yeah, it's great. Yeah. Well, it's brilliant. Well, thank you very much for talking to me today. Thanks for listening. This is Naomi Walter from Broadcliffe News. And we have got a CPAP monitor here today if anyone would like to have a look.